Hello everyone, my name is Dr. Chen. Today, I will go over how to position and scan the right kidney. This assessment is very important for evaluating whether the patient has hydronephrosis or a complicated infection. When scanning the right kidney, you can place the probe where the xiphoid intersects with the anterior axillary line. We don't start from the retroperitoneum because we use the liver as an acoustic window for observation. Through the liver, we can look downward to visualize the kidney. If bowel gas or feces in the large intestine obstruct the view, we can slowly move the probe posteriorly to make necessary angle adjustments. At that point, you'll be able to see more of the kidney's structure. The main focus in a POCUS scan is the central hyperechoic region of the renal pelvis, mainly to see if it is enlarged due to hydronephrosis caused by hydrodynamic situation. I hope this is helpful to your practice. And that's all for today's tutorial. I will see you in the upcoming videos.